Mr. Whitfield.
Thank you, Mr. Chairman. And I think every member of this committee, as we enter this important markup, is striving to balance the need to reform the current healthcare system against the need also to prevent the economic collapse of the American economy. If you read almost any economist today, they point out very clearly how concerned they are about the current deficit of the U.S. government and how over the next few years with Social Security, Medicare, and Medicaid, we actually are going to be entering a very dangerous time for America. History shows also all too clearly that the cost of government programs are routinely underestimated. In 1965, when they were debating the beginning of the Medicare program, it was projected by many groups, including CBO, that the cost of the program in 1990 would be $12 billion. The actual cost in 1990 was $107 billion, and today it is over $450 billion. So at this present time in our economy, when we're striving with this huge deficit, it's imperative that this program be paid for. And we hear frequently that it will be paid for. But, for example, the Hospital Association has evidently committed to cuts of $155 billion over 10 years to help pay for this program. And I have a letter from the Kentucky Hospital Association, and they state very clearly that their share of that $155 billion will put the hospitals of Kentucky in such a precarious position financially that they question whether or not they can provide quality care that they need to do. And then, furthermore, I would say to you that small businesses still create most jobs in America today. And with the mandate that this legislation places on small businesses, particularly the pay or play mandate, in which they either have to provide a basic level of health care coverage covering 72% of the health care cost of their employee, or pay 8% tax to the government if the employee chooses to enter that plan. NFIB, other small business organizations say they are quite concerned about the impact that will have on small businesses as they help to try to get the America out of this current economic condition. So this is going to be a vitally important markup. We look forward to working with the other side of the aisle and everyone to come up with meaningful solutions to this very serious problem. Thank you.
Thank you, Mr. Whitfield.